Chronicle. Joe, what has been the reaction in the US to the news?
Well, it's been shock. It's been shock because we're in uncharted territory here. But you also have to put in context that the president has been downplaying. The irony here is the president's been downplaying the coronavirus from the beginning of it. He said it would go away, naturally. He said it would go away by Easter Sunday. He rarely wears masks in public. He mocked Joe Biden for wearing a mask the other night, and he constantly does that. And as you saw, the images you've been showing, his staff doesn't wear masks either. So when they were on the plane to Cleveland, about 20 of his inner circle were with him, and there's going to have to be some serious contact tracing to figure out how far this virus traveled. This could have not only a devastating impact to the president's campaign, he can't be traveling, but also he does run the country. So there's a lot of impacts here, and we don't quite know how far this is going to spool out.
Well, that's the key, really. The contact tracing effort, Joe, now is massive. The president has done a lot of travelling. He's met a lot of people in the last few months and on the campaign trail, but as well as Melania Trump and Donald Trump's aide, Hope Hicks, as well. Just how big now is this effort to get in contact with everybody he has come into close contact with?
Well, that's underway right now. And of course, you have with the White House staff, they're regular testing people all the time. They're testing the president, his staff. And we couldn't have a finer medical professionals be doing that in great facilities at the White House, too, to take care of the president. So there's that. Then there's what happens to this campaign? The debates are very likely off, at least the next one on 15th, as Peter Ducey alluded to there. The vice presidential debate, provided Kamala Harris and Mike Pence are still okay. That's scheduled for next week. That will be on. And then what happens? We're going several steps down the road. If the president can't continue the campaign, does Mike Pence move up to the top of the ticket? And how does that affect everything? And by now, voting has already started in the United States. More than 1 million people have already cast ballots. So the game is on. We're 33 days away from Election Day. And there's still a lot of unknown questions.
So many unknown questions. But the key is what happens now with the election? Could it now potentially be postponed, and should it be?
I don't know. That will be another question to ask here. I don't think it would be postponed. I think that if Vice President Pence, he would step up and then he would choose a new running mate. There's also the 25th Amendment. The president, if he is incapacitated for a certain amount of time, he can willfully give up his power, and if the vice president moves up to the number one slot, then when the president gets better, he would reassume his duties. So this is both a governing question and a political question.
We still don't know exactly when Donald Trump first started displaying symptoms of COVID-19, but what we do know is that his aide, Hope Hicks, she was at that debate on Tuesday in Cleveland. She was there. We don't know how many people she came into contact with. What happens now with Joe Biden? Do you expect that he will be forced into quarantine and take a test immediately?
Oh, I'm sure if he hasn't been tested already, he will. Somebody's waking him up right now because it's the middle of the night on the East Coast here of the United States right now. And so I'm sure he's being tested, and we'll be getting those results just as soon as we know them. Let's also remember that the president is, 74 years old, and that's a higher risk group. And he's also overweight. He weighs about 243 pounds in U.S. terms. So he is, that's considered overweight at this point. So those are also two risk factors that he has to consider in terms of his own health.
Well, that's the other thing is we don't know exactly how sick he and Melania Trump are right now. We did, though, get that letter from Donald Trump's physician saying that the president and First Lady are both well at this time. They plan to remain at home within the White House during their convalescence, but we still don't know exactly how sick they both are.
No, apparently right now they both have said that they're fine. They're feeling fine. The president, matter of fact, is supposed to do a call tomorrow with seniors to talk about issues involving seniors. So that will be, and he plans to apparently do that by phone from his office in the White House.
And what about the reaction to this from a political perspective? Do you expect this will be politicised? Will Donald Trump's political rivals rub salt into the wounds?
Twitter is already burning up with those type of remarks now. But let's watch to see how the president handles this. Does he continue, if he should recover from this quickly, or if he never becomes symptomatic? How does his attitude change about the coronavirus? Does he start wearing a mask? Does he start talking about it in different terms? Does he stop dismissing it? Does he start listening more to the scientists around him instead of dismissing them, like Dr. Fauci? That's what I'm going to be watching is what the president's reaction is, and what will the people who support him, so many of them who dismiss the use of masks, many of them who dismiss science, do his supporters follow his lead? Do they think differently of the virus's effects after this?